me start with the first question. How is Omicron affecting our health staff? Well, let me just say that I probably cannot express, to the full degree, but our team is under extreme pressure at present because, well, for different reasons. One, the demand for testing is really, really high. All right, I know persons have the experience of going out to our health facilities, and they know that they have to wait some time. All right, so that is one. The demand for testing is really, really high, and I mean these are humans that are doing this testing. All right, they're testing yesterday 1,800 plus. All right, it's a large. The amount of work that they have to put in is really, really a lot, and I hope the public takes note of this. In addition, we have, in some instances, staff who become infected because what we have observed more commonly, a family member brings it home, and this disease spreads very easily within the household. So we have to isolate, or we have to quarantine individuals, which results in a reduction in the number of persons available to actually do the work. So it's a huge burden right now. Our team has so far been able to, overcome the difficulties and still produce the numbers that you are seeing. All right, still produce. I mean, when you look at the number of tests that we're doing and you compare it to many other countries, it's incredible, and I am amazed how they're able to achieve this every day. And we thank them. All right, we thank them, and we hope that the public would be patient and recognize the human service that they're putting in. To ensure that we all get through this together. I think the other question was with regards to schools and maybe decisions on opening schools and closing schools and so on. The thing is, what has to be realized is that, how long did it take for us to go from Delta to Omicron? In 3 months. What all of this has shown to us is that what is most common right now is uncertainty, and uncertainty as a result of everything that is happening with this pandemic. The education of our children has been disrupted now for 2 years, all right, for 2 whole years. And the question is, you have to examine the risks and the benefits. How much longer can we withhold the education of our students, especially in the context where, one, every measure that can be taken to control this disease, we have implemented. All right, we have recommended the public health and social measures, the protocols, the mask wearing, all of those. We have acquired vaccines. We have enough vaccines to vaccinate all of those individuals out there to protect themselves. All right, we have implemented whatever protocols that are recommended to control this disease. All right, yet we see that this pandemic is clever. So the question is, for how long do we withhold the education of our students? Because remember, health is not just the absence of disease, it's not just the absence of COVID. We have to think about the holistic health of our students. And formal education, face-to-face education, is a very, very, very important part of this. So the question is, do we risk our children's future, for maybe after this variant, another one comes up, and then we say no, and then another one comes up, and then we say no, and then another one comes up, and we say no? Or do we start the process of us all adapting to live with this virus and to thrive despite the existence of the virus? And that is the question. All right. So the question for everyone out there is, in my opinion, there is no ideal time. All right. There is no ideal time, but we have to recognize what is our priority with regards to education. All right, and we have to recognize that it is extremely important, and that's all of this is what factored into our decisions with regards to school. Thanks.
Thank you, CMO. Colleagues, anybody else ready with questions? Somebody's asking on social media, Minister, anybody from the panel, if non-national or a visitor dies here, will their death be counted in Grenada's death toll as well?
Well, yes, if a visitor dies here and dies as a result of COVID, yes, we have to count it.
Thank you. Nancy McGuire, good morning.
Good morning. I didn't quite hear earlier the breakdown, but in terms of the number of children that have proven positive, can you just update me on that? I'm sorry I missed it. And do we have any long COVID cases here, people that just never get over it? And in the number of healthcare workers that are off sick, is there a comparison with that to the sort of number, the average of the population that is sick? If you don't have the actual numbers of how many healthcare workers we have and how many are off sick. Thank you very much.
Just to address the first question, as it relates to the number of students who have tested positive for COVID-19. Now, what I can tell you is the age breakdown. So there are 11 of the active cases we currently have, 11.5% are in persons under the age of 18, right? And that is usually the school age. Now, just to add to that, as it relates to vaccination, now our data shows that, almost 1,600 students, have been vaccinated against COVID-19, right? So I want to commend those parents, that see the need and the importance and the urgency of vaccination, right? Because that in itself, is one of the ways out in combination with our public health protocols. And, these variants are showing us that, the latest variant, Omicron, who knows what will be next, right? But these variants are showing us the urgency to vaccinate. And that urgency is now. It is not tomorrow. It is not next week. It is now. And if you look at our numbers, and thankfully, when we look at our hospitalizations again, we see there again the benefits and the importance of vaccination. I can't recall what was the other question. If you can just...
Long COVID-19 cases and the number of healthcare workers who are ill.
As it relates to long COVID, we do have persons here who have long COVID, and we continue to have persons coming forward with symptoms that suggest long COVID. As to the actual number of cases of long COVID, I don't have that number here with me today. But again, to that point, right, COVID-19, or the virus that causes COVID-19 in itself, causes a lot of long-term effects on persons, and some of the common symptoms persons are having here in Grenada of long COVID includes things like fatigue. So a lot of persons complain of just chronic fatigue. They're tired all the time. And these are persons who would have recovered 3 weeks or more after being infected. Another symptom that we see a lot, persons complaining of continuous difficulty breathing, right, and memory fog. So these are the common symptoms we see here in persons complaining of symptoms of long COVID. And yes, we do have cases on island.
If you can just explain what long COVID is, because the way Nancy's question was, it sort of implied persons who haven't cleared for COVID as opposed to long COVID.
Okay. So long COVID, right? Now long COVID is basically persons who continue to experience symptoms of COVID-19 after fully recovering, after being recovered, right? So after that recovery period has passed, persons continue to have symptoms. And the definition basically of that, or the time frame, usually is 3 weeks or more after being diagnosed with COVID-19, right? So we have persons that continue to have what I call long-term effects of COVID-19. And we do know this is important, and this is why I always say, I do not want COVID, right? Because we do know, not from COVID, but from other viruses do cause long-term complications. If you look at chikungunya, we still have people today who complain of arthritis or those symptoms, right? And when we look at other viruses, they are associated with a lot of, conditions and complications. For instance, one of the things that viruses are linked with are cancers. So we really don't know, as it relates to COVID-19 and as it relates to future symptoms that people may develop or experience, or future complications. And that is why I urge everyone, to follow the public health protocols. Follow those protocols. These protocols is what prevent you from becoming infected. And we have to remember how COVID is transmitted, right? So an important part of that is wearing our mask properly to cover our nose and our mouth, hand washing or sanitizing. These things are very, very important. Social distancing. I know at this point, we sound like a broken record, continuing to remind persons of those measures. But these measures are important. Protect yourself from COVID-19. Because the truth is, and I said this before, we really do not know how our body will react immediately, right, if we get COVID, or we do not know what sort of complications we may have in the future, right, if we get infected with COVID. So as much as possible, I am urging persons, right, to protect yourself from contracting the virus.
Thank you. Colleagues, anybody else with questions? Nancy, you have another question?
Yes, I do. I was wondering when the chief medical officer was commenting on how pressured our health care workers are just with all these tests that we're doing and the vaccinations and everything else that goes with it. Are we getting help from the private doctors and the private clinics here? Thank you.
All right, let me just say that the thing is, at present, before, when we had the previous outbreak, we relied heavily, particularly on weekends and so on volunteers and other individuals who came forth and offered a tremendous level of support, and that assisted us greatly in quickly getting this the situation under control. We anticipate, we hope to, actually we are preparing, all right? We are preparing to resume this kind of activity again, and we have reached out to individuals to, come on board and assist us, volunteering with testing and vaccinating and all of that. And, hopefully in the coming days, I'll be able to tell you that, we have 10, 20, 30, we have a, significant proportion of the medical fraternity and the nursing fraternity, the healthcare fraternity outside of the public service that is assisting us once again as we all, fight together to get this under control.
Thank you. I have another question here. Can you confirm reports that there is a medical doctor at Princess Royal in Carriacou testing positive for COVID.
Let me just say that our healthcare staff are people, all right? And what is particular about our healthcare staff is that they work in scenarios where there is the highest level of risk, all right? And that is why they should be held in high regard because of this. However, yes, we do have healthcare workers who may, get infected as well. This can happen anywhere. I mean, this is something that has occurred, worldwide, and we are no exception. All right, we have had, healthcare workers on the mainland that have become infected, and we have had healthcare workers in other instances. So that would be my answer to that question.
Thank you. Colleagues, anybody else has questions?
Well, I'm still waiting an answer for my question about the number of healthcare workers.
Nancy again? Nancy, good morning.
Hi again. I'm just wondering about the number of healthcare workers that are off sick. Is it comparable to the population that is off sick? If you don't have the actual numbers of healthcare workers. Thank you.
No, I do not have that number at hand right now, but I can always reach out because remember the Ministry of Health has both healthcare facilities we have hospitals and we have community. Community alone has about 35, health facilities, and we have 4 hospitals. So I can try to get that information and maybe send it to you.
Thank you. So Dr. Charles, Mariana Charles, would you have a percentage of the visitors who have COVID from the numbers that have been given?
I currently do not have that breakdown, but what I can tell you that at present we are experiencing our second wave. We have community spread, and most of the cases that has been detected have been local cases. So most of our cases have been local cases.
So we're getting ready to wrap things up, colleagues. Anybody else with final questions? All right, it seems as though we've exhausted all questions. So, Dr. Mariana Charles, we'll start with you, then we'll go to the CMO and the final word from the Honorable Minister.
I would just like to express, gratitude, to the general public for upkeeping the protocols, for persons I see out there wearing their masks, doing the right thing, for persons who got vaccinated. I know that we are all tired. I know that we are all exhausted. Our healthcare staff, our nurses, our doctors, everyone, our pharmacists, our administrative staff, everyone is exhausted. But what I also know is that ending this pandemic also takes everyone, right? We need to keep everyone safe. We all need to do the right thing. And I just want to encourage everyone to hang in there, right? Hang in there. I feel very hopeful about 2022, but I also want us to, take a look around. Those variants are teaching us a lesson. Right? Those variants, again, are showing us that there is a race to be won, and it's a race between vaccination and the virus, right? So we need to stop the variants. We need to stop the virus. And one of the most significant ways we can do that is by getting vaccinated. And I want to urge people now, there is an urgency to get vaccinated, and that urgency is now, right? Let's get out there, let's get vaccinated. Our data in Grenada, regional data, international data, is showing us the importance of vaccination, right? The data is right here. When we look at our hospitalized cases, the persons with COVID pneumonia, we have 6 persons, 5 not vaccinated, and that same 5 is suffering from COVID pneumonia, right? Vaccination works. and it works in combination with the public health protocols to prevent contracting the virus. So I want to urge everyone, and I know I may sound like a broken record, to go over there and get vaccinated. You know, Grenada has the largest number of vaccines we ever had, right? And we have a variety of vaccines. We have viral vector vaccines, AstraZeneca, Johnson & Johnson. You have a choice. We also have Pfizer. Go over there and get vaccinated. And I'd also like to end just to give a breakdown in terms of persons with long COVID, you know, just for the knowledge of everyone out there. You know, long COVID is, you know, quite an informal term. So the formal term, persons who continue to have symptoms, what we call it one of two things: ongoing symptomatic COVID or post-COVID syndrome. So persons who continue to have symptoms 12 weeks or more after recovery, that is now considered as post-COVID syndrome, right? And the persons who continue to have symptoms after 3 to 4 weeks, that is now considered as ongoing symptomatic COVID, right? And again, COVID in itself, the virus that causes COVID-19, it don't just come, you get symptoms, you recover. What we see that there is complications. Persons continue to have symptoms even after a year of diagnosis. Persons continue to have things like memory fog, continue to feel tired all the time, right? You do not want that. So I want to encourage everyone, go out there and get vaccinated. Vaccinated is our way out. Vaccination is the way to end this pandemic, right? And again, I'm very hopeful for 2022. I want to encourage, you know, the rest of the population, what 32% fully vaccinated, the rest of the population, the eligible population, go over there and get vaccinated. The vaccines are available throughout the week at the National Stadium, in all our health centers, and some of our medical stations. You know, some of the private offices, private doctors' offices as well. So go out there and make that choice to protect yourself, to protect your loved ones, and to contribute to ending this pandemic.
Thank you so much, Dr. Mayana Charles. Dr. Sean Charles, I have a final question here that maybe you can include in your wrap-up. Some people are testing at home with home kits and are not reporting it. How does it affect our data, as well as the fact that some people are not even isolating? What problem is this posing for us?
Right, that is a very important observation. The thing is, if someone tests at home and they test positive, and that data is not reported to the Ministry of Health, then it simply means that we will not be able to report the accurate, a more accurate figure to the public about the extent to which the disease is affecting the country. So we will be undercounting. Now, additionally, if there are persons out there who are positive and they are moving around, these individuals are endangering the lives of everyone, right? And that's why we say, you know, personal responsibility. Personal responsibility is the most important factor going forward as we continue to fight this disease, all right? Because we cannot reach into every home, we cannot reach into every corner of this country and, prevent persons from, encountering others who may be infected. We really rely on, individuals in the public to at least cooperate and to, I always say, be a brother's keeper, all right? Protect the people around you, all right? Act responsibly. So, as I wrap up, let me just say that the talk, all right, and the conclusion from the scientific community across the world is that COVID is becoming endemic. All right, COVID is becoming endemic. What endemic means is that it will always be here. All right, just like we have dengue. Dengue is endemic in Grenada. We always have some level of dengue circulating, at whatever time in the year. So, what this means is that there may never be a time when there is zero COVID. All right, and persons must take this into consideration. All right, it is possible that this disease is always going to be circulating at some level in the population. and we must accept this. But at the same time, we know that what we are asking persons to do is to change, make lifestyle changes. And we know change is one of the most difficult things to accept. But unfortunately, this is the new normal. We expect that persons in the education sector will quickly adapt to the new reality. All right, because it is here and it cannot be ignored. And at the same time, the education of our children as well cannot be ignored any further. The health sector, the health team has already adapted to COVID. I remember when we just started, there was a lot of fear. And I'm certain that persons can recall that when COVID just started, the majority of private offices, private medical offices in Grenada shut down. You could not get an appointment to see a private doctor in their office. That's at the start of COVID. All right, because everyone was fearful. All cases straight to hospital. Now, they're all opened. They're all opened, despite the spike in cases that we have right now. You can go see a private doctor tomorrow or this morning if you wish. Why? Because they have adapted to the new reality, that this disease is here and we must live with it. We know that the business sector has adapted. All right, the business sector has adapted. Many businesses were closed earlier on in COVID. Now, everyone is doing everything in their power to ensure that they keep their doors open. All right, so this is what we expect for education now. This is just the most recent sector that needs to adapt to the new reality that we are living in. All right, that is the only way we will all be able to, thrive in this country. All right, and I just want to thank our healthcare team, very hard working out there, both in the public and private sector. Our nurses who are out there, they're on their feet the entire day, testing individuals, and then collating all that information and sending to the Ministry of Health. All of the individuals who are working to support the response, the effort that we are mounting right now to address this wave and to get past it. All our team that are out there vaccinating, because they're vaccinating and they're testing and they're advising and they're educating, and all of that is ongoing. All right, and at the same time they are ensuring that their families are taken care of. All right, sometimes you get the impressions that sometimes we don't think that our healthcare staff are there every day. They are people just like us. They have children, they have families, and they go out there and they sometimes interact with dozens of positive cases, and then they go back home to their families. And we have all adapted, and we want everyone to support us. We will get through this wave, and whatever comes after, we will get through it. All right, we just need to stay focused. Thank you.
Thank you very much, CMO. We head over now to the Honorable Minister for Health for the final words.
Thank you, and let me say that as Dr. Charles has said, Sean Charles, the virus is becoming endemic, and this is one of the realities that we all have to face. One way to prevent ourselves from suffering and succumbing to hospitalization or severe symptoms is to get vaccinated. As has become obvious, vaccines don't stop you possibly from testing positive, but there's so many people that we have seen in the last week that have tested positive with absolutely no symptoms, and almost 99.9% of those individuals are the vaccinated individuals, not even aware that they were positive, but came to get tested because they were close to or exposed to someone who did learn they were positive. And then there's so many people here in Grenada and elsewhere that are ending up in hospital not vaccinated. And we can read the list of individuals who are in hospital: hypertension, diabetes, and asthma. Please, if you have any of those, sugar, pressure, asthma, you most definitely need to be vaccinated. Definitely. Do not let anyone tell you that those are reasons not to be vaccinated. Those are reasons that you will end up in hospital if you get COVID-19 without being vaccinated. You need to arm yourself as much as possible. We are in a very fortunate position here in Grenada, and we have worked hard as a ministry and government to get to this position where we have vaccines available for anyone above the age of 12. In the UK, up until Christmas, 12 and over could not get their second dose. Many 12 and over could not get their second dose because it was scheduled and because of shortage of supplies. In Grenada, we have enough vaccines right now for anyone 12 and over who would like to be vaccinated. We are looking forward within the next month to possibly have doses for 5 to 11 of the Pfizer. We have already sourced and are procuring, and will announce as soon as we have those. I look forward to individuals who have children 5 to 11 coming forward to be vaccinated once those vaccines are available, readily available. We have ordered thousands. Once they are here, we will make those announcements. In the meantime, it is our responsibility, those of us who can be vaccinated, to come forward and receive our vaccine and our booster. We need to give our children the best weapons to fight this disease. We need to ensure that our children get back to school as quickly as possible with as little risk as possible. And that is by ensuring that our children and our teachers and support staff are vaccinated so that we can continue life with a disease that is becoming endemic. So I want to close by thanking, as always, all of those who continue to follow the guidelines, individuals who have come forward, been vaccinated, boosted, our volunteers who are coming out and assisting in vaccination drives, testing drives throughout the country, and those, our community health personnel, doctors, nurses, individuals at the General Hospital, Royal Grenada Police Force, as always, for continuing to provide yeoman service to all of us, helping to keep all of us as safe as possible during this continued period of challenge that we will get over. I have every confidence that we will get over. We will push through, like most other countries are doing. So again, thank you all, and please stay safe, get vaccinated, follow the protocols.
Thank you very much, Honourable Minister for Health and Social Security, the Honourable Nicholas Steele. Thank you to Dr. Sean Charles as well, Acting Chief Medical Officer, as well as to Dr. Mayana Charles, the Senior Medical Officer. Colleagues, to all of you who joined us via Zoom this morning, thank you as well. For those of you who joined us via Channel 22, our Facebook page and the YouTube channel, and of course those of you in the diaspora, thank you so much as well. We hope you got all the information that you need this morning. Here's hoping that you have a blessed and productive day. We'll see you again next week. Thank you.